Go up, down.
And you press on the scapula. Can I see?
I'm just using it to hold it.
Okay.
If the patient is really tight and I cannot do this, what I like to do is ask the patient to lie down face up.
Face up. Okay.
So if the scapula, you cannot get your fingers underneath it. She's coming down. Just give me a second, okay? So what I like to do is I put my finger, so I go right under this border of the scapula to the ribs, and I'm on the ribs. And I just do this. And you just wait.
Okay.
Gravity will bring down the scapula. Just wait. You don't have to push hard, you just have to leave your fingers there. If you feel like your fingers get tired, you can put a pillow there, you can put anything, you can have your arm like that and put it the side of your hand. Just lift up the ribs a little bit, allow the scapula to drop. It will drop, it might take a minute or two, it will drop down. Gravity will pull it down, don't worry. And if you want to create more force, you can push the elbow out and just create force that way. And it will become painful, but you can open it up faster. Yeah, but free treatment and everything. Just like that. Something that I've seen you guys when you're practicing, I know a lot of you guys are already practitioner, but if you want to listen deeper, thank you so much. If you want to listen deeper and get better at palpating the patient, I'm going to give you a couple of pointers because I've seen a lot of you guys are palpating a little bit in a hard way. So you want to be always make sure that you're close to the patient when you're palpating them. You don't want to. You want to make sure that your arms are not all extended and you're not far away from the patient, because when you have a stress under your muscles, there's pressure coming down. Your nervous system sends the signal in different places, and it makes it less focused on your fingers. So you always want to be close. You want to make sure that you're close to the patient and you're not extended out, and then you palpate and just go a little bit deeper. Try to feel. Don't stay there and try to be able to feel at the beginning. You want to go in and dig around a little bit. Slowly increase your pressure. And slowly you're going to be able to feel deeper and better. Just have a light touch, but have a continuous touch, and you're going to be able to find it. But I've seen a lot of you, when you're palpating, you're standing far away from the patient and you're doing this. And I don't know how you get to palpate. Sorry. Hi. Oh, you're part of the class? I don't know. Sure. The next thing that I would like to cover, any questions up until here?
Like if it's painful for patients, so how pressure is supposed to be, like just enough? Or doesn't matter if they
like reduce pressure. You don't want to give patient pain. Like I make a lot of jokes. Some pains are okay. Like if you put your hand under and it just the ribs feels a little bit painful by pushing it, that's not a bad thing. But when you're close to the trigger points and stuff, we don't want to create pressure that way. We don't want to push the patient that way. Unless I tried every other way of releasing something, I don't create tension on the patient. That's completely against, like in osteopathy, you want to keep the nervous system down, and you don't want to create that much pressure. So if there's a trigger point there, just use the same concept that we talked about yesterday, right? So you can work on it in through motions. So have a light touch. You can make it short and hold it and just rock it.
But
and it will reduce.
If it's all this movement painful, so just like
what movements?
or even like that.
Then I start going through that and release them before I go there. Like you cannot just jump into something and it's painful and let's force it. If it's painful, if me bending it down is painful, so her problem is not there. Her problem starts here. Her problem could start from the wrist or anywhere. You need to start from the point that you can release as much as you can and go forward until you fix the problem. Because you're right, it could be problem with the elbow too, so you release it that first. So same concept, if you want to release rotators, you just rotate it, make it short and hold it. And you can see that this trigger point will go away in like 20 seconds, 30 seconds.
So for the scapula, where did you put your right hand?
Medial border.
Just medial border of the scapula on the ribs. So I cup the scapula to make sure that the scapula has a space to drop down. You can also, if you feel like your hands is tired, you can go from the side and be there. Doesn't matter where you go, you can go from both sides and use two hands to do it. Just make sure you leave a space for the scapula to come down, it will drop down. Okay guys? So now we have shoulder mobilizations as well.